Good morning. I'm Tim Sheehy, President of the MMAC, and I want to thank you for joining us for our weekly Business Strategies webcast every Tuesdays from 11 to 12. MMAC's mission is to develop Metro Milwaukee as a globally competitive location for businesses that deliver high-value jobs to foster a vibrant quality of life for all. This program provides actionable insights into the challenges and opportunities we all face in developing the region as a better place to live, work, play, and learn. This webcast is powered by Aurora WDC, a Madison-based market and intelligence firm. They help us make faster and smarter decisions. Visit them at aurorawdc.com. We're going to start with an update on COVID-19, its impact, and the steps to improve the region's health, and we'll do that with Dr. Raymond, President of the Medical College of Wisconsin. Next slide. You can also get your Dr. Raymond fix on Tuesday afternoons now on 620 WTMJ at 4:20 in the afternoons. Then we have a great panel to discuss how we manage the impact of COVID-19 through this fall, through the rising cases, what's being done, what can be done, and what businesses should be doing. And to help us with those topics, we'll be joined by Mayor Tom Barrett, Dr. Laura Cassidy, Professor and Director of Epidemiology at the Medical College of Wisconsin, and Judi Williams-Killackey, a partner at Quarles and Brady. And again, if you've got questions during the program, please submit them and we'll do our best to answer as many as we can. So let's get an update from Dr. Raymond. Let's start here. Dr. Raymond?
Okay, thanks, Tim, and welcome back.
Thank you.
Before I begin the first slide, I do want to start with the punchline, and that's that our early indicators of COVID-19 are very concerning, the worst we've seen since mid-March. On the other hand, our lagging indicators still look pretty good. So we'll go through those now. Here on the first slide, we're going to talk about testing. And as of yesterday, we'd administered nearly 700,000 COVID-19 diagnostic tests in Wisconsin and about 143,000 in Milwaukee. And we've had about 36,500 positive tests in Wisconsin for a rate of 5.3%. Now, ideally, we want that rate to be consistently under 5%, and it's actually been trending upward over the last week or two. In Milwaukee, we've had a little over 14,000 positive tests with a positivity rate of 9.9%. Again, we want that rate to be under 5%. So the number of tests reported in Wisconsin yesterday was relatively light, about 6,600, and we've been normally running between 10 and 12,000. Now the testing capacity continues to improve. We're up to a capacity of 24,362 per day in Wisconsin, with 83 laboratories currently testing and 24 in the pipeline who've applied to test. Now, we've never come close to using the full capacity. Our largest day was about 16,000 back in early June. So ideally, we'd like to see us using that capacity more effectively. Now, in terms of yesterday, I do want to say we had 494 positive tests. That's a fairly high number, and that was the highest number that we've had reported on a Monday since the beginning of the pandemic, and the positivity rate was 7.5% in Wisconsin. 170 of those positive tests were in Milwaukee with a 10.9% 7-day positivity average. Now, I do want to point out that the 4 days before yesterday were the 4 highest days of positive tests reported in Wisconsin during the pandemic. I do want to anticipate a question here. The higher numbers of positive cases are not simply due to increased testing. For example, in Milwaukee, the testing has gone up by about 40% over the last few weeks, but the positive cases have doubled over the same time frame. In Wisconsin, the tests reported actually have remained flat for the last few weeks, yet the numbers of positive cases have gone up very significantly. So there are a couple things going on here. One may be an increase in testing, but that simply doesn't account for the entirety of the increased number of positive cases. Next slide, please. I'll talk about hospitalizations, and there's some good news here. Since the beginning of the pandemic, we've hospitalized a little over 3,800 patients with a 10.4% likelihood of being hospitalized if you have a COVID-19 positive test. And that rate has gone down consistently since the beginning of the pandemic, in part because of increased availability of testing, and in part because we know a lot more about how to better triage patients with COVID-19 now than we did in March. So in terms of hospitalizations yesterday, 283 patients with COVID-19 hospitalized in Wisconsin hospitals, and that is increasing. It's a trend we've seen for the last 2 weeks with a slow increase. In terms of ICU admissions, we have 85, and again, that's also been increasing over the last 2 weeks, but neither of those are anywhere close to our maximum numbers that we experienced on April 9th. So our ICU capacity, we have 414 immediately available ICU beds, and that's stable and that's perfectly adequate. Ventilator capacity is 960. That's very copious, perfectly adequate. And in terms of PPE trends, those are stable, with the most critical needs being goggles and gowns. And next slide, please. Now, I do want to talk about death. This is a highly lagging indicator. You know, the indicators that we talked about earlier are early indicators, that especially the positive number of cases. So we've had 820 deaths in Wisconsin, none reported yesterday, and 359 in Milwaukee. And it's important to note this is a lagging indicator, yet we are seeing continuous declines in the numbers and the rates of death, both in Wisconsin and in Milwaukee. And we hope to maintain that. But again, because our numbers of positive cases are going up and the percent or the positivity rate is not where we need it to be, we need to look 4 to 6 weeks down the road. So in terms of deaths, these do disproportionately affect both people and communities of color, as you can see here in the slide, and that has not changed significantly over the last few weeks, although I would note that the number of Hispanic and Latinx cases and the number of Hispanic and Latinx deaths is starting to creep up. Doubling time for positive tests is about 34 days in Wisconsin and 40 days in Milwaukee. Those are good numbers. But remember, if we double the number of cases over the next 30 or 40 days, that's another 38,000 cases. So even with that fairly long doubling time, we'd still like to see that stretch out even further. And in fact, the trend over the last week has been for that doubling time to actually shrink a little bit. So that's another negative trend that we need to follow. Daily positive growth rate of positive tests averaged over the last 7 days, 2% in Wisconsin, 1.9% in Milwaukee. And again, those are low numbers, which is good. On the other hand, we're talking about 38,000 cases. So even with a 2% increase, that's still a lot of cases. Now here's a troubling early indicator here, our reproductive number, which is a measure of the contagiousness in a given place at a given time. We want that to be under 1.0 because basically a 1.0 would mean one person with a COVID-19 infection would pass it on to one other person before they run the course of their infection. And we're at 1.22 in Wisconsin and 1.37 in Milwaukee, which is our high since early March. Next slide, please. Thanks, Austin. This slide shows the 7-day average reproductive numbers since mid-March for Milwaukee in tan and Wisconsin in blue. And I want to draw your attention to the red arrow near the far right of the slide. And that showed an inflection point that began a 26-day run of reproductive numbers over 1 for both Milwaukee and Wisconsin. And those are unfavorable trends. And unfortunately, this long run came after a promising 16-day consecutive stretch when the reproductive number was less than 1. And during which there was clear evidence of a deceleration of the pandemic. And unfortunately, I think what we're seeing now is a trend toward an acceleration of the pandemic. Next slide, please. Now, the last time I presented to you and the previous times before that, I said that we'd reached a tenuous equilibrium with COVID-19. And I encourage diligent use of the only tools that we had available to us at that time, which are still our only available tools. And those include physical distancing, hand and respiratory hygiene, and sanitization. Next slide, please. Now, many might ask, what can we do to mitigate the spread? And I'd like to reiterate the importance of the 3 W's. Wash your hands, wear a mask, and watch your distance, which means maintaining at least 6 feet between you and people who don't live with you in your home. Now, this slide I've shown before several times, It shows evidence from a recent meta-analysis published in The Lancet. And what it shows is the risk of transmission drops from 13% to 3% simply by increasing your separation from another person from 1 foot to 1 meter. And then that risk decreases by 50% for each additional meter of increased distance. So again, that really highlights the importance of maintaining safe physical distance. Next slide, please. This slide here basically shows, if you look on the left-hand side, that masking works well. And the left-hand panel shows that masks are most effective when both you and those around you wear a face covering. Now, the top right-hand panel illustrates more findings from that Lancet paper described on the previous slide. All told, it showed that face coverings reduce risk from COVID-19, and that some face coverings are better than others. So as you would expect, the N95 respirator gives the best protection. Surgical masks or the paper masks give the next best protection. But multi-layer cloth masks and single-layer cloth masks still provide some degree of protection both to those around you and to the person who wears the mask. And additionally, there's a little bit of new evidence suggesting that face shields might also offer some protection of similar magnitude to face coverings, although there have been many fewer studies on face shields. Next slide, please. Now, as we see surges in cases and increasing positivity rates across the country and here in Wisconsin, we do need to understand that hospitalizations and ICU use lags cases by 2 to 4 weeks, and the deaths may lag even several weeks more. And that's important to note because despite the younger age demographic of the newer cases that we've seen over the last few months, it's imperative that we continue best practices of diligent physical distancing, hand and respiratory hygiene, face coverings, and sanitization. Those are the best tools that we have to keep everyone safe. And I do want to remind everybody that even though our cases are younger, young people can still get sick and die from COVID-19, and we may also suffer from a secondary transmission from those younger individuals to older loved ones, coworkers, and friends. So with that, I'll turn it back over to Tim.
Thanks, Dr. Raymond, for that very thorough update. Just kind of one question before I bring Dr. Cassidy in here, or really two questions. What's the most concerning news over the last 2 weeks, and what's the best news over the last 2 weeks as you look at the COVID statistics?
Well, let me start with the best news. Our hospitals aren't full. We have plenty of ICU capacity, and we have 4 to 6 weeks to change our behavior. So I'd start off with the best news. The worst news actually comes from other states. If you look at California, Texas, Florida, and Arizona, we're pretty much where they were 5 weeks ago. Looking pretty good in terms of hospitalizations, but with rising case counts and positivity rates. Right now, their ICUs are filling up, their hospitals are full, and I'm sure that you've read some of the stories about, especially in Arizona and Texas, some of the counties are ordering refrigerated morgue trucks because unlike what we saw in May and June, the death rates are actually starting to go up pretty significantly in those states. And on average now in the US, we're seeing an uptick in the number of deaths. So that's the bad news. But again, the good news is here in Wisconsin, we have the opportunity to learn what happened in these other states and to do a better job.
Yeah, thank you, Dr. Raymond. Dr. Cassidy, let's bring you in here and help us or just walk through what we can do in terms of our workforce, our customers and facilities, and kind of how you see us continuing to address this challenge as we go into the fall.
Thank you, Tim. Because this is a new virus and nobody's immune, it quickly became a pandemic, and we find ourselves in a situation that nobody's ever been in before. And we're trying to learn as much as we can as quickly as possible. So it can appear like an overwhelming amount of information and different sources. And so we were asked to help people think through how to operate in a healthy and safe way. And so we came up with this framework to think about it, both in our work and in our daily lives. As Dr. Raymond mentioned, it's a respiratory virus that is spread from person to person, and it can exist on surfaces. So we get the virus by interacting too closely for an extended period of time without proper distancing, masks, and sanitation. So we developed this framework to think about how people interact with each other and how they interact with the facility to guide our thinking moving forward. Next slide, please. And so there's really, 3 phases: preparing, operating, and then monitoring and responding. So it's really important to have good plans and protocols in place because none of us have been through this before, and these behaviors aren't natural to us. Staying away from each other, distancing, wearing face coverings, that's not natural behavior for us. It's a learned behavior that we need to practice. So by having protocols in place for physical distancing, for sanitizing, for PPE, and then having good training and communication plans and reinforcing them, not just in the beginning, but periodically as we go through, and evaluating how we're operating is how we're going to stay on top of this. And like Dr. Raymond mentioned, the rates are starting to go up now, and some of the indicators are not looking good. So this is the time to act. What we do now will affect how we operate and if we can operate in the future. So it's one thing to develop the plans, but then you have to operationalize them. And the more people practice these behaviors, the more we will become accustomed to them. So there's a lot of toolkits and various information out there on MMAC website and other websites that you can access, but keeping in mind how we interact with ourselves in the environment is what we really need to focus on. And then finally, while operating, especially with the rates, keeping your eye on the community rates, what's going on in the community, and the reports that Dr. Raymond gives helps alert us to how the disease is spreading. And if there's more disease in the community and it's spreading faster, we are at higher risk and we have to be especially careful. So having a monitoring and response plan in place is essential because if and when there is a positive case, you don't want to react to a crisis, you want to control it. So working with your local health department, they have a lot of experience and guidance in this area, knowing who they are. Monitoring the cases in the community and within your business is essential. Now, if you have a suspected or positive case within your workplace, it's important to have that protocol already established so employees know what to expect, the supervisors know what to expect, and we know what to do. So if there's a suspected case, if somebody's at work and they're not feeling well, you want them to be comfortable coming and saying, I need to go home. If somebody's not feeling well, you want them to be comfortable saying, I'm not coming into work today, because the best thing you can do is not spread it. If you're sick, stay home. So there has to be plans in place to assure employees that they can do this. Now, if somebody does get sick at work, you want to isolate them immediately, find safe transportation home, disinfect the work area, and make sure they know the plan to when to go to the doctor, when to go to the hospital. And you also have to make sure you maintain that employee's confidentiality. Next slide, please. Now, when there is a positive case, it is important to minimize the spread. So the health department considers 2 cases an outbreak. They're not going to come in and shut you down, but they will come in and help you deal with it. So it's important that you contact your local health department as quickly as possible if you have a case in your workplace. And they will come in and help with a case investigation and contact tracing. So the employee should go home, quarantine, isolate, and the health department will interview them and find out who they've been in close contact with and provide services to help them self-isolate and to get through the illness. And they will also do contact tracing where they notify people who have potential exposure from interacting with that person. And that's really important too, because they can also educate the people who have been in contact with potential exposures about symptoms to be aware of, where to get testing, resources to support quarantine while they're waiting for their test results. And again, if they're not feeling well, when do they go to the hospital? When do they go to the doctor? And how to minimize their symptoms. So the sooner you contact the health department, the better, because then we can minimize the spread. So if employees are comfortable, if they feel supported and there's trust where they can, stay home when they're sick or get to let you know when there is a case, then it can be minimized quickly. If you wait a few days, then the people they've exposed may have exposed others, and it'll be a bigger problem. Next slide, please. So how do we, what are the strategies for ensuring people comply with this? Because again, it is new. It goes against our human behavior. We all have to modify the way we're living our lives, and it's not fun. So it's important to analyze the benefits in the program so that employees are not penalized for taking sick leave if they need to, because the best thing you can do is isolate people who are sick. Effective training and communication is essential. People, if they know what to expect, it's much easier. They have to feel comfortable asking questions, having clear policies so people know what to do and things don't get out of hand, and also engage your employees and their supervisors for their help in creating these plans, because they understand how they work, what will work, and make them part of the solution, and so that they're highly engaged. And moving forward, the more we open up, the more we operate, the safer we need to be. Thank you.
Yeah, thank you, Dr. Cassidy. Very, very practical advice. And as I know you're going to stick around and be able to answer questions. And so as we kind of move from the theory and how this can be implemented, I want to bring in Mayor Barrett, who I presume, Mayor, today you're going to be signing a new ordinance for the city of Milwaukee. And I want you to talk a little bit about what's in the ordinance and why this city decided to move in this direction.
Thank you very much, Tim, and I'm pleased to join you once again. Obviously, listening to Dr. Raymond and Dr. Cassidy, you can see that, unfortunately, we're not making the progress that we need to make. And it was actually 4 months ago yesterday that we had our first case in the city of Milwaukee. And so you can just see over the last 4 months how all of our lives have changed dramatically. And if there's one thing that we have learned over the last 4 months, it's that COVID-19 does not grant any exemptions or exceptions to anybody for any political reasons or religious reasons, that everybody is prone to this. Now, we know there are some groups, as Dr. Raymond and Dr. Cassidy have talked about, who are more prone and are more prone to get sicker. The elderly, those with underlying health conditions are at risk. We also have learned just how prevalent asymptomatic spreading can be, and how much the rate of infection has dropped dramatically. When we started out, it was in the 50 to 60-year-old range. Now the group that's getting the disease the most are the 20 to 30-year-olds, the invincibles, the super people. Probably the most troubling statistic that Dr. Raymond used today was that reproductive rate, which is now at 1.37 in Milwaukee. About a month ago, that was below 1. And so we have to make progress, and we have to take steps here. And we don't want to take the step of closing everything down. But short of that, we feel, based on the science and all the recommendations we hear from CDC, that having the masks is very, very important. So our ordinance applies indoors, so restaurants, businesses, indoors, and outdoors when you are unable to maintain that 6-foot differential. So if you're going for a walk or you're going for a bike ride, that's not what we're talking about. We're talking about if you're on a patio or if you're at a gathering where you cannot maintain that distance of greater than 6 feet, that's when you're required to wear the mask. This is not meant in any way to be punitive. In fact, I would say to the contrary, this is educational, and health oriented. The enforcement mechanism is going to be through the health department, not through the police department. And we wanted to do that to, again, send the message that this is about health. The onus in many ways is going to be placed on the business owners to make sure that people comply. And part of the reason for that is that the push for this came in large part from parts of the business community, the restaurant industry in particular, who I think wanted to have, for lack of a better term, the government good housekeeping seal of approval on this policy, which we have done now on a unanimous vote of the city council, to say that, look, if you come into a restaurant or a bar, you're required to wear the mask. Obviously, you don't wear it while you're eating, but at other times you wear the mask. So to the extent that there is going to be enforcement, it will be through the health department. There'll be a warning first, and then the fines can go from $50 to $500. But it is my hope that we don't have to have any fines, and that what we saw over the weekend is our health department enforcement teams went out to about 94 establishments, and there were only 4 that they felt were problems. So already we're seeing great compliance, but we know, again, as Dr. Raymond said, that wearing the masks can be very beneficial, and that's why we're doing what we're doing.
Yeah, and I know, Mayor, one of the concerns that some employers had was, putting themselves in the position of kind of enforcing this ordinance. But I suppose it'd be like if you had a business that had a capacity for fire purposes of 50 and you had 60 people in there, the business has to enforce that. So is it really much different than some of the other ordinances that businesses have to enforce on their own premises?
And it's really not different in any way. And that's the reason we took this route, is we wanted to make sure that it went through the legislative process. So it is not something that is coming solely from the health commissioner. We wanted to make sure that people could weigh in on this. But I think in many ways, it gives businesses a tool to say, look, this is what the law is. This is what we have to follow. And the reason, as people understand, is not necessarily for yourself, but people can be asymptomatic spreaders. And we want to make sure that we're not spreading this disease. There are close to 135,000 people in this country who have died from this disease, and none of them wanted to get it. None of them wanted to get it. So that's why we're dealing with it in this fashion.
And this may be getting the cart before the horse, Mayor, but what's the process now to lift the ordinance? I mean, what will have to happen for this ordinance to be lifted?
Well, when the health commissioner ends the emergency order or her health order, then it would automatically be revoked. If the council takes action, that would be another way for it to be revoked. Again, looking at the numbers that Dr. Raymond was showing, it is disconcerting that we are not only not seeing progress, but we're seeing numbers going in the wrong direction. And as he said, our numbers are pretty much analogous to the numbers that people saw in California and Texas, Arizona, and Florida 4 to 5 weeks ago. So it's my hope that by taking this action now, we will not be seeing those overcrowded ICU units or hospital beds 4 or 5 weeks from now. But I can't guarantee that. But we really did feel we've got to take action that's meaningful, that we believe people will comply with. And so again, from an educational standpoint, that's why we think this is so important.
Yeah, and it's really not becoming unique. I was on vacation the last week or two, and in my travels, it's no matter what city I was in or what marketplace I was in, everybody's wearing a mask. It's just becoming kind of a normal course of business. When we go back, as you said, a couple months ago, and it was odd to see somebody with a mask. Now it's odd to see somebody without one.
I can still remember the first person I saw wearing a mask about 2 months ago, and I thought, what are you doing? And now when I see someone in a grocery store who's not wearing a mask, I'm thinking, what are you doing?
Can you, I'm going to switch gears a little bit with you. Can you talk a little bit about how you see the pending plan for the Milwaukee Public Schools going virtual to start and kind of what that means for the city and for people coming back to work?
Well, let me talk about the schools first, because I still have a lot of concerns, and my concerns really lie in the area of connectivity. Because in a lot of the suburban areas, for example, you've got great connectivity so that parents can have their kids do the virtual learning. There are parts of the city where you don't have that, and we're able to deal with a lot of the hardware issues. But the Milwaukee Public Schools Foundation is still trying to raise a significant amount of money to improve the connectivity so that kids in central cities where you don't have the hotspots, that they'll be able to literally go to class. So to me, that's a real issue. That's a real issue that we've been working with the school system, with the Milwaukee Public Schools Foundation, with Tina Chang and others who have contributed to that fund to improve the connectivity. But that is obviously going to be an issue. But as you alluded to, the childcare is an incredibly important part of this, whether you're a parent who needs to go to work, or you're a parent who wants to make sure that your kid is in a safe place. We're continuing to work with the child care providers to make sure that they can be in operation. But again, I think so much of this is in uncharted waters that I can't say, and I just met with the superintendent yesterday and we talked about the plan. I think that this is the plan, but again, things are changing so quickly. I can't guarantee, I don't think anybody can guarantee that they'll be able to execute it exactly as they planned, which is to have the first 30 to 40 days roughly as the virtual learning, then to have the kids in school for 2 days a week and then to go back. I don't know what the suburban schools are going to do, but I think that this is still very, very much up in the air in a lot of different school districts.
Yeah. Have you gotten, as we've moved through this now, any better clarity on the upcoming city budget and some of the challenges that you see there?
Well, even before we had COVID-19, even before we had the civil unrest, even before we had the economic tsunami, our budget looked really, really grim for this year. And as I said last year, when we eliminated a number of police positions, that was not a philosophical decision. That was a fiscal decision. Those issues have been amplified. And so with all of the conversation and all the noise about funding the police department and other departments, I'm looking at that issue before any of the civil unrest, that we literally do not have the resources to fund the police department at the level that we have funded it over the last few years. And that's why we've worked so hard. And I really appreciate the work that you and others have done to try to get the state to listen to this. But people are going to see it. People are going to see it in this next budget because we didn't get any help from the state. And we simply can't print money at the local level.
Yeah, and let me ask one final question here, Mayor, before we pivot to our last panelist here. And can you talk a little bit about the transition in one of the most important positions in your administration, and that's the Department of City Development, as Rocky Marcoux retires, and now you bring on Lafayette Crump?
Well, Rocky probably finished his job within the last 2 hours. I think Lafayette was sworn in this morning. So Lafayette is our new DCD commissioner, and we're very excited. He knows the community well. Rocky, of course, is just a one of a kind. He worked harder than just about anybody in city government to try to develop the city. And so I'm certainly going to miss him. But I'm excited to have Lafayette, who brings a lot of the same skills that Rocky has. And I think at the same time, I think he understands, as Rocky did, the importance of having development, not just in the heart of the city, in the downtown, but in all the neighborhoods. And I think that's one of the things that people didn't recognize, how much work Rocky had done in the neighborhoods. But we're going to continue to make that a priority as well.
Well, congratulations on the transition. I think it's an important one and a good next step.
Thank you, Tim. Thanks for everything.
Yep. Okay, and then let's pivot now and bring Judi Williams-Killackey back in, who's a partner with Quarles and Brady. And Judi, you're going to take us through a little bit of an overview for companies on some of the health and legal issues, and then we'll wrap up with questions for all of our panel.
Yes, thank you for having me today. I'm going to talk about some considerations that employers should be thinking about in order to prevent increased cases of COVID in the workplace. First, I do suggest that as an employer, you create a COVID response or preparedness team to address things like policy changes, protocol for responding to suspected or positive cases, and the handling of such cases. As Dr. Cassidy mentioned, you want to be proactive in this situation, and you're not going to have much time to react if you do have a positive case. It is important to engage in those measures that were previously mentioned relating to cleaning and social distancing. You don't want your employees to become sick. You want to be able to continue your operations. And I do think that it's important that if you have a cluster of cases, you take a step back and you look at maybe where you have vulnerabilities. Are you missing something in your cleaning? Are you still having social interactions occurring maybe in places that you weren't expecting? You could also consider staggering shifts or break times. Keep in mind that for the unionized employers out there, you may need to bargain changes like this with your unions. So it can take some preparation. You don't want to be doing anything at the last minute. You also, obviously, as the mayor just talked about, need to consider the protective gear and hygiene supplies. With regard to masks, it's important to realize that you may have obligations to conduct training if you're requiring the use of the mask. The training would include things like how they should be worn, when they should be worn, how to maintain the mask, and when they need to be replaced. And then a final consideration regarding safety has to do with screening procedures. The EEOC has made clear that employers can, in fact, use temperature testing for employees as long as they're not discriminating in doing so and as long as they maintain confidentiality of any medical information that is obtained. The problem with temperature testing is that it's one point in time. So some of our employers have gone to self-reporting, where workers are asked to confirm on a daily basis that they are asymptomatic and have not been in contact with anybody who is symptomatic. Keep in mind that if you do have employees who are testing positive, you have an obligation to ascertain whether the illness is work-related for OSHA purposes. And in addition, if it's a work-related illness, you might end up having a workers' compensation claim. Now, I know no employer likes to have a workers' compensation claim, but that's not necessarily bad in this situation, because if the illness is covered by workers' compensation, that in most situations is going to bar the employee from asserting other types of claims based upon the illness. Next slide, please. So you also want to ensure that your policies comply with COVID-19 requirements, including FFCRA requirements. In particular, I would tell you that some of you are going to be required to comply with that. Some of you aren't. It depends upon how many employees you have. But if you don't have an FFCRA policy in place, I would encourage you to put one in place as soon as possible. In addition, there are new policies that you probably want to consider based upon the pandemic. Those include policies relating to temporary requirements for physical distancing and hygiene, reporting of concerns, requests for leaves of absences. And you also probably have policies already in place that now maybe need to be updated based upon the COVID outbreak. For instance, you may have an attendance policy in place which has a no-fault standard, and if a certain number of absences are missed, the employee is disciplined and eventually terminated. As Dr. Cassidy mentioned, you want your employees comfortable reporting to you if they're not feeling well, and so you may want to consider modifications to the attendance policy that might discourage reporting. In addition, teleworking, we've had a lot of employers who've engaged in teleworking for the first time. You may not have had a policy in place. You may have had a policy in place. Now is the time to be looking at those situations and implementing a policy if you didn't already have one, or reviewing it and deciding, do we need to make some changes based upon what we saw during the first wave of teleworking. Next slide, please. So the other thing I would recommend is a communication plan. It's really important that employees feel like they know what is going on in light of the circumstances. As many people say, this is a new normal. And so it's important that employees be made aware of what's going on in the workplace. So your communication plan could address things like safety protocols, reminders relating to social distancing, updates in policies and procedures, and anything else that may be changed in the work environment. You also want to consider a policy relating to monitoring of symptoms in the workplace. In particular, you want employees to know how you're going to handle symptomatic individuals or potentially infected or infected workers. The policy should cover things like expectations for sick employees. Who are they supposed to contact? What is the expectation of what's going to happen? Is quarantining going to occur for everybody, for only certain people? You also want to consider the procedures for returning people to work. Are they going to have a negative test, 2 negative tests before they can return, or is it going to be based upon an abatement of symptoms? You also want to talk about and consider plans for contact tracing. As Dr. Cassidy mentioned, you should be working with your local health department, but it's also important that you be thinking about who in the workplace the employee may have had contact with. The employee may not know everybody they've had contact with. They may not be thinking of everybody they may have had contact with. And so as an employer, it's good for you to have plans if you have a positive test about how you're going to determine who may have been potentially exposed. And then also in that policy, it's good to consider how you're going to communicate with the workforce. Some of our clients are telling the entire workforce, some are limiting it to the work site or only individuals who are exposed or potentially exposed. But once again, this is not something that you want to be deciding once you have a positive test. You want to be thinking right now about how are we going to react when we get that news and who are we going to tell. Next slide, please. So another issue that has come up with some of our clients is they've had clusters of employees who become ill or who they've had to quarantine because one employee tested positive, and they've been caught in an operational bind. What I mean by that is maybe you have one department that is producing widgets that you need for your end product, and all the employees in that department are now quarantined. How are you going to operate if that happens in the future? Do you have excess inventory that you can use? Do you have individuals who are trained who can go into the department and perform the work necessary to produce those widgets? If not, cross-training might be something to consider. Another possibility might be, instead of having everybody in a department on one shift, to have them on different shifts to try to limit the possibility that everybody will be subject to quarantine who is actually producing the product. You also want to, as part of that team I mentioned at the beginning, consider designating an employee who is responsible for making sure that you are up to date on changes in guidance. We have seen frequent changes in guidance from the CDC. OSHA has went back and forth on whether or not you need to worry about whether the illness is work-related and putting it on logs. So it's really important that you keep up to date on changes, and having somebody who is tasked with doing that can be very helpful. You also want to identify opportunities to boost morale. This, unfortunately, is a very trying time emotionally and mentally for lots of people, and they may not feel as appreciated as they did. Things have changed in the work environment. Maybe you had a potluck, or you had pizza parties every Friday. Obviously, you can't do that now. Maybe you can do it in a different way. Maybe you can do boxed lunches, or you can provide some sort of a casual day, or anything that might provide employees with some belief and some basis to understand that you do appreciate them and that you are there as their employer to not just have them work, but also protect them. And then finally, HR needs to be properly administering the FFCRA and other leaves. It's very possible you're going to have employees who are teleworking, who aren't working right now, who don't want to come back to work. And you need to have a process in place regarding how you're going to handle that. You may have some obligations under the law for individuals who have medical conditions in particular, and you don't want to be violating any of your obligations by simply denying leave and not having a good process in place. Thank you.
Yeah, thank you very much, Judi, for a very thorough and insightful overview. Very helpful. I'm going to bring Dr. Cassidy back, and if the mayor is still with us, ask him to come back. And Chris, let's go to questions.
Yeah, this may be best addressed by Dr. Cassidy. I believe Dr. Raymond may have left for another commitment, but I believe that Wisconsin has just been added to New York State's travel advisory list. What does that mean?
Well, I think it means that they don't want us traveling to New York. Sorry, I've done a lot of these webinars. I think that that's a little scary. It means that our rates are going up too quickly, the reproductive numbers up too quickly, and the disease is spreading here. And so that means it's time we really need to buckle down and get it under control. We did a really good job in March. I mean, it was extreme measures doing safer at home. I'm hoping we don't have to do that again. If now we start just being more diligent with masks, physical distancing, and slowing the spread, we can do it.
Dr. Cassidy, do we have any kind of reciprocity agreements? I mean, do we have anything set up in Wisconsin where other states can't travel here?
I don't know. The mayor might know that.
I don't think we do. I don't think we do.
Okay.
Might be a good idea.
Question for Dr. Cassidy and Judi. What are a business's requirements to report a positive test to the health department, and what procedures should they follow?
Judi, would you like to take it?
Well, sure. I mean, with regard to requirements, I always tell my clients that if they get notified of a positive test, they need to contact the local health department immediately. We've had some health departments, I think Milwaukee is one of them, which have done a very good job in the contact tracing, but we've had others where they've not been as robust. And I think it's really important to get on the radar screen and work with the local health department as much as possible. I also think that sometimes employers are more conservative in who they think was in direct contact with an individual, and that it's important to work with the health department to make sure that you really have identified everybody who might have been in contact and that you're working closely with them to make sure that we're not limiting who's quarantined and really who should not be out in the environment.
And I think it's very important to be clear that it's not punitive. It's helpful to contact the local health department. They're here to help us. They're not here to come in and close things down, and to have that mindset.
A related question, are there any HIPAA concerns for an employer reporting this to the health department?
Well, I'm not a HIPAA attorney, but I don't think there are, based upon the fact that you received it as an employer, not as an insurance plan.
Mayor Barrett, we had a couple of questions about some of the details of the mask ordinance. One of those are for people who work in a private business office. Are they required to have a mask on at all times, or would it just be in common areas? What's the policy there?
Again, I would be applying that 6-foot rule. If you've got that 6-foot difference, I think that's what it is. And a lot of this is common sense. It's not like we're going to be sending the health department to every office in the city. This is educational, and if you've got the interaction, you should be wearing the mask.
Another question along those lines, what about private events like weddings? Does this apply to that?
Again, if you're going to be within 6 feet, there is no wedding exemption from COVID-19. There's no funeral exemption. There's no political party exemption. There certainly is no frat party exemption. We've seen stories about that. So if you're going to be within 6 feet, you should be wearing the mask.
Mayor, can you still kiss the bride?
Room care.
Virtually, you can virtually kiss her.
Remembered as a COVID outbreak.
Mayor Barrett, if I go to a restaurant this afternoon or this evening, where do or don't I have to wear a mask, and when?
Well, we just had and Dr. Cassidy was on the webinar we had this morning for restaurants, and obviously there's going to be a difference. If you're sitting down and you're eating, you're not going to be having the mask on. A number of the restaurants have taken out their bar stools, for example, and others have moved them around. I would say, again, common sense really comes into play here. If you're eating or drinking, you're not going to be wearing your mask. If you're socializing, you wear your mask. The servers most oftentimes will be wearing their masks because they don't want to get sick either. So keep in mind the employees that are working in these establishments, because as Judi said, there is a lot of stress right now for employees as well. People are afraid to go back to work, and as a customer, you don't want to create a scenario where it's harder for the employee to do their job.
Very good. Dr. Cassidy, what do we know about the possibility of getting reinfected with COVID if you've had it once already?
I don't think we really know enough about it yet. There's not strong evidence that if you've had it, that you have immunity, and for how long. If it behaves like other viruses, then hopefully the case is that we do build up immunities, but we don't know how long that will last. Again, we're learning so much, and that's where it gets confusing, because there's also conflicting studies out, which happens in epidemiologic studies. We look for reproducibility and result.
Yeah, Dr. Cassidy, a related question to that is some people read about the possibility that antibodies are detected only for a short time in some patients, and they get concerned about the development of a vaccine. Are those related issues, or are they separate?
Well, I think they're still investigating that. There's some studies out there that suggest that the antibodies may not last, but the T-cell response does, which would provide longer-term immunity, but it's harder to test for.
Very good, thank you. Judi, we had a question from an audience member about the biggest areas of liability for a business related to COVID, and whether those areas should relate to making a decision about whether employees should continue to work virtually.
Yeah, so well, first of all, like I said, if you do have work-related illnesses, in most circumstances, they're going to be covered under the workers' compensation exclusivity bar, which means that the only recourse the employee does have is under the workers' comp system. That being said, you need to operate, right? And so you should not just go out there and rely upon the fact, oh, I'm not going to have a claim from an employee because I'll be able to rely upon workers' compensation. You, as an employer, need to make sure that your employees are sick so that you can operate, so that they feel safe coming to work, so that they want to come to work and are not worried about teleworking. I think it's going to be, for many clients, a benefit analysis and an analysis of what the safety reasons are for bringing somebody back. If you have a teleworking workforce and that's working fine, the question might be, why do we need to bring them back right now, especially when we've seen the increased rates that we've been talking about on this webinar. But unfortunately, there are a lot of employers that can't do that, right? They're manufacturing parts and other things that they need to have people physically in the workplace. And then for those individuals, I think the most important thing right now is to look at your workplace and do those things that Dr. Cassidy was talking about, social distancing, protective gear, in order to make sure that they can safely work.
Judi, a couple of detailed questions came in related to that. Can an employer ask an employee to provide documentation for positive COVID test?
Well, I think the reason would be why. Why do you need the positive test? In most circumstances, we have been, I think, advising employers to ask for the positive test if they have a concern about whether or not the individual is for some reason not telling the truth. But I think it's been pretty rare where people have not been telling the truth and have had a positive test. I think the bigger issue isn't if they have a positive test, but when they come in and they say, well, I may have been exposed. And what do you do in that circumstance, right? I think you need to have a discussion at that time to say, well, what do you mean you may have been exposed? And try to figure out, is it something where the person, was at a grocery store for 5 minutes, they found out their neighbor was there and tested positive, or was it something where they were at a frat party like Mayor Barrett was talking about, and they were there for 2 hours with somebody who tested positive?
Related question to that, can an employer require an employee to go get tested?
So I do not recommend requiring employees to go get tested. I've had some clients where they have suggested that, but I think that there's some privacy issues involved. And what I normally recommend is having a discussion with the employee about asking that they get tested, or telling them if they don't want to get tested that they're going to have to self-quarantine for 14 days, and then having a discussion of what does that look like.
Thank you. Question possibly for Dr. Cassidy and Mayor Barrett, if you want to chime in. We're seeing in some of these hot spots nationally some delays in testing results. It seems like we have pretty good capacity here in Wisconsin. Are we concerned about that here at all?
Well, I think the delay in results is a big concern. I know it can take up to 5 days. And so the problem is, if somebody goes in for a test and then they have to wait 5 days, will they stay home and self-quarantine in case it's positive? That's a difficult thing for many people to do. So having the ability to get test results back more quickly would be a key component to slowing the spread.
And I can tell you that when we first began this several months ago, particularly with the National Guard, there were some delays initially. We got those all ironed out. Then we had a little bit of a backlog at the city level. We've got that again ironed out. So it's something that we have to be vigilant on to make sure that we can get the results as quickly as we can. 2 quick points on that. One, we still have the National Guard sites in Milwaukee County. They're located in the city of Milwaukee, at UMOS on the south side, which is on South Chase on the north side, at Custer Obama High School, which is essentially Fairmont and Sherman Boulevard. Nicolay High School has one. And so I would ask people to do that. Otherwise, call 211. 211 is still the place, particularly if you're symptomatic, to get tested. But test. That's still a big part of what we need to do. Get tested.
Mayor, is the city's overall workforce are still working remotely? Where does that stand?
Well, it depends on the department. Obviously, the police department, the fire department, the Department of Public Works are all out there. A lot of City Hall is still working remotely. A lot of the Department of Neighborhood Services is working remotely, although they're bringing some people back for some of the work that's done in the field. It depends on the department, but there are still a lot of people working remotely.
Yeah. I guess I'd ask all 3 of you, kind of just from your own sense. I know what we're hearing from employers is that, the thought of bringing people back later in the summer has now moved to early or late fall, and in some cases, even the first of the year. I don't know what you're hearing, Mayor, Judi, what you're hearing for your clients and customers, and Dr. Cassidy, what you recommend.
Let's go to Dr. Cassidy first to see what she recommends.
Okay. Well, I think, given that the rates are rising right now and that the reproductive numbers going up, to the extent where we can work at home, we should. For my division, I'm recommending we stay home till the beginning of the year, but we can do that. We can do this video chatting, we can write, we can, it's not a huge challenge for us. There's some people who can't do that. But But I think to the extent we can minimize interacting, especially in groups, whether it's work or socially, is what we really need to do right now. We need to take the action and the responsibility to do this now so it's not forced upon us later.
Judi, what are you recommending for your clients?
Yeah, you know, a lot of my clients are manufacturing clients, and working from home just is not feasible for them. You know, to the extent they have office employees, they're still working from home. You know, I have construction clients and the office employees are working at home, but obviously the construction workers are out on the work site. I think it really does depend upon the nature of the business. And unfortunately, it's a very tough, challenging, and frustrating process, I think, because as Dr. Cassidy said, we do want to keep people safe. Employers do want their employees to be safe, but at the same time, they want to have a business that they can come back to. And so it really, I think, is a balancing act. And most of my employers are doing that balancing, and they're trying to figure out, well, where can we have people stay at home, and for how long can we have them stay at home, and where can't we, because we actually need them physically there.
Mayor, this has got to be a big challenge for all of us in the city. If you think about, you know, restaurants, bars, dry cleaning, hotels, all the things that are being affected by these reasonable choices people are making working remotely.
Right, and we hear the same things that you're hearing, Tim, in terms of it's all across the board in terms of the ability to come back to work. And as Judi was saying, there's some employers that simply have to have people there. They simply have to have people there. Then there's others, as Dr. Cassidy said, who have the luxury, and I mean that, the luxury of being able to work from home. And unfortunately, what you're seeing are, not surprisingly, is a lot of the lower income people and the people of color are the ones who are going to be on the front lines. And that's why we're seeing higher numbers in those demographics. So it creates a lot of challenges for us as a community. There's no question about that.
Yeah. Chris, maybe one last question.
Yeah, well, we had a question for Dr. Cassidy. As we look at the death rate and how it's maybe declined nationally, what have we learned about treating COVID-19 that's improved outcomes potentially?
Well, I think we've learned a lot. And one of the keys is not to delay care. We've learned that people might be ill for about 7 days, and then they take a turn for the worse. And so to be aware and to seek treatment when you need to. The other thing is, I think they're starting to rely less on ventilators, because that can actually damage the lungs, and increase like the oxygen that they provide to people. And then I know there's other treatments, and I'm really bad at more than two syllables. I can't say the word. Remdesivir.
Remdesivir.
Yeah, that one. So there's drugs like that, and drugs you can do in treatment, in combination therapy. So we are learning, and we are decreasing the hospital length of stay. Whether we're decreasing the mortality rate yet is unclear, because it depends on who is getting sick. But I do think we're making strides in how to treat it, mostly by the outcome now is reducing the length of stay in the hospital.
Great. Thank you, and thanks to everybody who asked a question today.
Yep. Mayor Barrett, thank you again for your time and your leadership. Judi, thank you very much for the insights for employers. Dr. Cassidy, always appreciate your insights. And as we wrap up here, I'll go to the last slide and encourage companies that are out there, or if you know a company, we've got to focus on future awards, which is really a way in this challenging time to identify companies that have inspired you throughout this crisis, and we'd like to help tell those stories as we look forward. So again, thank you for joining us. We'll be back again next Tuesday at 11 o'clock, and again this afternoon at 4:20 on WTMJ 620. Dr. Raymond and I will be talking about some of the challenges and again opportunities as we go forward. So enjoy the rest of your day, and thank you for joining us.
Thank you.